This video refers to principle of MMT. We are going to explore the principle of manual muscle testing, its grading, how to do this test. We will also explore the right uses of this testing methodology for your assessment program. So let's start by understanding what is MMT. MMT stands for manual muscle testing. Manual muscle testing is a clinical assessment technique used to evaluate the strength and function of individual muscle and group of muscles. Manual muscle testing is tested by a numerical scoring from 0 to 5. Now, this is the most common grading system which is given by Oxford scale. Grade 0 refers to no contraction. Grade 1 refers to the palpable contraction visible on the muscle. Grade 2 refers to the movement visible on the muscle but not against the gravity. Grade 3 refers to the movement against the gravity but not against resistance. Grade 4 where the movement is against the resistance but with some weakness found in the muscle. Grade 5 refers to the movement against the maximum resistance given by the therapist. Whenever there is grade 5, it refers to normal muscle. Grade 4 refers to a good muscle. Grade 3 refers to a fair muscle. Grade 2 refers to a poor muscle. And grade 1 refers to a trace muscle. Grade 0 refers to a zero muscle. Remember, we as a student will never get grades in a test and decide whether he or she is qualified, whether he or she is knowledgeable and competitive. Therefore, this grading system is similar to it. As we have learned the grades, now let's understand how to perform this MMT. Whenever we start with grade 3. Now you are looking towards the therapist and the patient. The therapist is saying to the patient, can you fold your hand? If the patient performs the movement on its own, that is called as grade 3. Now the patient position is sitting, standing, supine lying, depends on the type of the movement he is performing. Now here the patient is performing elbow flexion, performing on its own with no resistance in gravity. Now if the patient performs grade 3, then we move to grade 4 with minimum resistance by the therapist. Patient position is sitting, standing, supine lying. If the patient performs grade 4, then we move to grade 5 to see whether the patient can perform under maximum resistance given by the therapist. Let's explore the situation when the patient cannot perform the movement. At this condition, we perform grade 2. Here, the patient position is in a gravity eliminated plane. Hands will be supported on a wooden plank or movement performed on a couch or a movement performed in a side line or a prone line position. Now, in grade 2, there will be no resistance. The movement is performed in a gravity eliminated plane as such seen in the picture that the patient is performing the elbow flexion on a wooden table. Assume that this patient cannot perform grade 2. Then we move to grade 1. Grade 1 where there is no movement visible, flicker contraction of muscle while trying to perform the movement elbow flexion. If no movement is visible, no contraction is palpable, then this is called as grade 0. Now we can see that the patient is handling one arm over other. Any movement we perform, muscles are involved. In elbow flexion, brachialis, brachioradialis, bicep brachii are the primary muscles involved. The secondary muscles are also involved, that is pronator teres, extensor carpi radialis longus, flexor carpi radialis, flexor carpi ulnaris. These muscles helps in the movement of elbow flexion. Now let's recap. In this video, we learned what is MMT, what are the grades of MMT, how to test MMT by performing MMT of elbow flexion, and what are the muscles involved in the elbow flexion. Don't forget to subscribe, like, comment, and also give us reviews on our website www.physiopia.com. Thank you.